Okay, so right now we want to speak about the development of the urinary system. Okay, so we just need to understand a few things. Firstly, that the urinary system is derived from the intermediate mesoderm antica. So your kidneys come from your what? Intermediate mesoderm. So what happens initially is you form something that you call the urogenital ridge. Okay, so when you're talking about the urogenital ridge, it's just like intermediate mesoderm that forms my longitudinal elevations along the sides of the aorta. Yeah, so if you're looking at this one, so this will be your these exactly this one. This we can all see these ones, right? So this is your urogenital ridge. Okay, so from this one, that is where you are going to be forming your kidney. That's where you are going to be forming some a part of your genital system. And this is our gut system. You see, this is part of our hind gut, and this is part of our cloaca, right? Good. So what happens is right now we want to start by development of the kidneys, right? So the kidney it develops in three sequences, right? So when it develops in three sequences, we form what you call pronephros, mesonephros, and metanephros. So here, if you read your lungmen will tell you that the pronephros they will form in the region in the cervical region, okay? That is the region of the neck and the head there. And then your mesonephros, they form in your thoracolumbar region, and then your metanephrons will be your lumbosacral region. Okay, perfect. So but all of them they are derived from the urogenital ridge. Okay, so and then as you are saying, so the definitive kidney that we know it will be formed in your pelvis. Okay, right. So what happens is if you're looking at this picture, what happens is around the fourth week of development you form 10 pairs of tissue. Like if you look at this one, so this is the pronephros. Okay, so you just form these pronephric tubules, but then these structures they are rudimentary in a way like they never obtain function. Okay. Hmm? No sound. Guys, can you see this picture? Good. Guys, can you all see the picture that I'm using right now? The picture that shows my pronephros. Good.
No.
Okay.
Yes, Chugurwana.
Okay. Perfect. So here we are seeing what you call the pronephros. So the pronephros will be. Uh, so this is your pronephros. Okay, the region that is more superior. So it never becomes functional and is the first one to form in the fourth week of development, right? So formation of these pronephros will induce the region that is called out to it to form the mesonephric tubules. Okay, so the mesonephric tubules start to form again in the fourth week, but they form as the pronephros start to regress. That's when your mesonephric tubules start to form. Okay, so your mesonephric tubules, what they do, they will form a functional glomerulus that you are seeing here, this one, and you are seeing forming the glomerular capsule surrounding the everything. Okay, your glomerulus, your Bowman's capsule, and everything, and you are seeing it draining into the pronephric, into the mesonephric duct, which is just like a continuation of the pronephric duct. Okay, so you find, so one thing to remember is this, that your mesonephros will take over kidney function because it's the primitive filtration system of the kidney. So we need to remember this. But your pronephros, nothing. Okay, so as you later on develop, right, there is something like last stage. This one, you see that on the distal aspect of the mesonephric duct, you form something that you call the ureteric bud. Okay, so what happens? This starts to happen in the fifth week of development. The ureteric bud will start to go and invest into the metanephric blastema. Okay, you can hear words like metanephric blastema, metanephric cap is the same thing. Remember when I said the metanephros? Okay, this is the same thing that you're talking about. Okay, so remember that the ureteric bud comes from the mesonephric duct, and it is going to go and to invade the metanephric blastema, as we're talking about like right now. Okay, done. This we have spoken about all of them. So what happens is your metanephros, they will appear in the fifth week of development, and then they will become functional in the 12th week. That's where your definitive kidney has taken place now. So if you find that the kidney has got two systems, you've got the collecting system and your excretory system. So the collecting system is going to be coming from your, it's going to come from your what, ureteric bud, okay, which comes from the mesonephric duct. Okay, and then your excretory system is going to come from the metanephric blastema. Okay, so you're talking about your nephron, the metanephric blastema. Okay, so if you are talking about it as okay, yeah, this will be like your ureteric bud forms the urinal pelvis, your calyx, your ureter. This is part of what comes from the what? The ureteric bud, and everything else here, like the tissue, that means your nephron is going to come from your metanephric cap. Okay, but all of them is intermediate mesoderm. So again, so that is just that. Okay, perfect. And we have spoken about this. So with that, we have actually just spoken everything that we need to remember regarding the formation of kidneys. Okay, just to add more, maybe just we are seeing again for network in the other side, right? Right. So this region here is your pronephros. This region here is your mesonephros, and this is what you're talking about. That the mesonephric system is going to produce your what? Your ureteric bud. Your ureteric bud is going to invade into the metanephric blastema, right? And that's going to form our kidney, right? So again, we keep seeing this thing happening, and then this is the ureteric bud forms your renal pelvis, your major calyx, all the collecting system again, and the metanephric blastema forms your what? Your nephron. Okay, this is what you're just trying to see. This is your collecting tube. Everything part of the nephron is going to come from the metanephric tissue, and yeah, this is just what you're trying to see, right? Okay, perfect. So with that part, we are done with the development of the urinary system. Lastly, before we conclude and go to the MCQ session, we also need to speak about the development of the urinary bladder. Okay, so sorry, the development of the urinary bladder now is the next section that we need to speak about. But before we go there are a few clinicals that we need to speak about. You can have got, your kidneys. We said they are pelvic organs. So what they do is your kidneys, they ascend from the pelvis. They ascend from the pelvis, going all the way up to lie in your abdomen, right? So, and then as they are moving, they receive blood supply from branches of the abdominal aorta as they move upward, right? But you can have a situation of a horseshoe kidney, whereby your kidneys, they have fused, like, which is this one, okay? Your horseshoe kidney. So as your horseshoe kidney is trying to ascend upward, it's going to be stopped. Its progression upwards is going to be stopped by the root of your inferior mesenteric artery. You need to remember, it is the inferior mesenteric artery, not anything else. So it will be stopped by what? The root of your inferior mesenteric artery. Perfect. So with that, we are done. I think we are done with the development of the kidney. Now, lastly, before we finish, we can speak about development of the urinary bladder. Okay. Okay, so what happens is, if we open, okay, right, perfect. So this is your cloaca, right? Okay. Um, any question? I think Coachero Fanuel, you have a question.
So, like, there's an issue for accessory kidney. I need to ask you, in a papi kana LC level,
Okay. So when you have got an accessory kidney, um, so what happens with an accessory kidney? It's a kidney. Its location, okay, you're talking about its location. It can lie anywhere. Okay. You can find your kidney, like you can have your kidneys like in their normal place, and you can have accessory kidneys lying in the pelvic region. So there is no definitive position that I've personally, while I was reading, I did not see any definitive position as where you can find the accessory kidney angle. Yeah.
okay, I think so. Like, he kana iripo usually in a pelvis, and
Yeah.
oh, I bo.
Oh, so far so good. So we are all good, right? Right. So, mhm. Right. So back to where we were. Okay. So development of the urinary bladder, right? So you see that you have got your cloaca, right? So your cloaca is acting as a double system. Okay. So things that are coming down the hindgut are going to empty into the cloaca. Everything, the urine is going to empty into the cloaca. So we need to partition it into the anal canal posteriorly and anteriorly we need to have the urogenital sinus. Okay, so you start to form something that you form a mesenchymal wedge of tissue, right?
Can you confirm everyone?
Oh, guys, can you all see the slide that I'm using right now? Okay, perfect. People are saying, right here, right? You have got your mesenchymal tissue, right? Forming the urorectal septum, and it's going to start to divide, to partition the cloaca into the urogenital sinus anteriorly and posteriorly into your anal canal. So you see it, this is progression, and then you have got your primitive urogenital sinus that lies anterior, and then posterior you have your anal canal. Done. And then this wedge of mesenchymal tissue, this wedge of
Manje
like that, uh,
slide that is growing.
yes.
Slide that is growing.
How do you mean Bulaya the region?
I think slide, maybe it's an issue. Slide is like it's an issue of network. So you can start Buddha and then you rejoin, I think.
Bo baba.
Okay. Right. Okay. So if we continue with the thing about the bladder, right? So again, we said we're talking about the mesenchymal tissue that's going to differentiate the urorectal septum, differentiating your urogenital sinus and posterior your anal canal, right? Here it's going to form your perineal body. Remember that perineal body that you speak about, differentiating. Remember anteriorly when you are now talking about pelvis, like gross, that under the urogenital triangle, anal triangle, that thing in the center, the perineal body. That this is it now. Okay, perfect, done. So now this part of the urogenital sinus that you are speaking about, right, is going to start to divide and partition and form different parts of the system, right? You see, this cranial portion of the urogenital sinus is going to form the bladder. But it's also important to remember that this cranial portion is actually joined by the allantois. You see it? You see this one, continuous the allantois, remember? So, but then it's going to undergo a process whereby what do you call it? It undergoes degenerates to form something. It leaves a remnant and that you call the what? The urachus, and then it's going to form what? The median umbilical ligaments. Okay, that we know, right? So if you have got patterns of this one, if this does not close, because you see that it's in direct contact with the bladder. If it does, so we just need to take note of that. So right now we said the cranial portion of the urogenital sinus gives what? The which is the intermediate portion, right? The pelvic portion in males is going to give your prosthetic and your membranous urethra in males, right? And in females, it's going to give the entire urethra. That you need to remember. So this is the pelvic portion. And then this caudal portion is going to form what you call what? Your spongy urethra. Okay. So that we need to remember where those parts come from. So yeah, I think this is what you're speaking about. Your caudal portion, you can also call it the phallic portion. Yeah. So that is so this is exactly what we're trying to speak about. Now, lastly, if you remember the diagram, this is going to be your mesonephric duct. For those who are following, this is your ureteric bud. So what happens is your bladder sort of enters the bladder. The bladder sort of absorbs this whole thing, right? So it absorbs everything. So as it's absorbing, you find that your ureteric bud moves closer to the bladder until it's like this, and until we have got this arrangement, right? And then as your kidneys start to ascend upward, it will also cause these ureters, okay, to start to also move upward. You see, initially they're like here, but look at the end. They start to move what? Upward, okay, act like they are opening more superiorly to the vast difference if this is in males, okay. So we form a region here on the bladder that you call the trigon of the bladder, right? So what happens is the bladder is a hindgut structure. The cloaca is a hindgut structure, right? And we said that the bladder comes from the cranial portion. That means
Confirm if people are still in.
correct.
Network you know guys we shall know.
Can people confirm if they are still in, like if people are still following, can you just confirm?
tiri remote kunzwa
Okay, perfect.
This is okay, we need to go.
Right. So here we are. So we're talking about something called the trigon of the bladder, right? You said that the bladder is the cloaca is part of the hindgut, right? It's got endoderm and splanchnic mesoderm, right? So that means that things of the bladder are going to be different of like your muscles, your wara wara, are going to be coming from your splanchnic mesoderm, that, and then your epithelial lining is going to be coming from the endoderm, right? But the region of the trigon of the bladder is going to be coming from what? Intermediate mesoderm, because these structures here, they come from your intermediate mesoderm, right? So you find that it is the posterior smooth wall of the bladder. But if you read your language clearly, it will tell you that what happens is this. Initially, you've got this section, right? You've got this thing whereby it's lined by mesoderm. And then as the bladder grows, you're going to find out that the mesodermal cells are going to be replaced by the endodermal cells. So you find that your whole bladder is going to be becoming what? Endodermal in origin. Okay, but you just need to remember that the trigon initially is going to be developed from the mesoderm. Okay, done. Okay, perfect. So what you just need to know, right now, we are just like, is this like because your urogenital system is linked? Remember, we're just talking about the mesonephric ducts, okay, or the Ophian ducts, okay. Like remember when you said that the ureters they move cranially, so the mesonephric duct will move caudally and ducts, okay. But in females, due to lack of testicular androgens, you are going to find it degenerating. So this is just that, and this is just trying to explain how we form the trigon of the bladder, as I was saying again. So again, I think I just mentioned this already. The urethra, the development of the urethra. We have got the pre-prosthetic, the prosthetic, and the membranous urethra. I said it, they all come from the pelvic part of the urogenital sinus. And then the spongy urethra comes from the phallic part of the urogenital sinus. And then I said the female urethra, the entirety of it is going to come from the urogenital sinus. And that is that. And yeah, so that is what. And then we have got a few anomalies that we know. You have got an anomaly that you call bladder extrophy. So this is like a ventral body wall defect, like a failure of the ventral body wall to close in the region of the bladder, whereby your bladder is exposed. And when your bladder is exposed, even its mucosa is exposed, right? So that's something that you need to remember. And it's going to be linked with something that you call epispedias. Okay. So your epispedias, you're going to be having your penis that is opening on the dorsum of the penis, like your urethra, external urethral meatus is going to be opening on the dorsum of the penis. That you need to remember about bladder extrophy. So yeah, this is what you're trying to see. This is bladder extrophy. Bladder extrophy. And then the patterned urachus, I spoke about it. When you have a patterned urachus, you have urine dripping from the umbilicus, and then you said initially what you expect that urachus to form what your median umbilical ligaments again. Yeah. So that is that. And then the thing that I was speaking about, you've got hypospedias. So this is in males, hypospedias, and then epispedias. Okay. So we just need to be able to identify this. So in epispedias, your urethra opens on the dorsum of the penis, and then in hypospedias, it opens on the ventral portion of the penis. And that is that. So with that, I think we are done with the development of the urogenital system. So before we move to our MCQ session, is there anyone with any questions so far with regards to whatever we've just been speaking about? Anyone? Mr. Fano?
So, what time female urethra? What is it from the caudal portion of the urogenital sinus? Cannot deal with pie.
Okay. The entire female urethra, it comes from the pelvic portion. Okay, so you've got three portions, right? Your cranial, your pelvic, and your caudal portion. So it comes from the pelvic portion.
Oh, I have a
Good. Perfect. So if no one has any question, we can just move to our MCQs. Is there anyone with any question before we move? Okay, perfect. So we now want to move on to our MCQ session, right? So this is just going to be fast since we have already discussed much of the stuff again. Okay, right. Maybe just this last thing that we did not mention about the bladder defects, right? You can have what you call, you remember when you have a patent urachus, you can have this one, whereby the urachus is completely like, yeah, it's opening, it's like there's a complete connection between the urachus and the bladder, like this one. It's a urachal fistula. Or you can have this one that you call urachal cyst. It's just a cyst, it's not in communication with the bladder or the umbilicus. Or you can have what you call a urachal sinus. This one, it's not in communication with the bladder, but it is in communication with the external surface. Just wanted to mention that and get that out of the way. Right, perfect. Number one, concerning development of the urinary system, the pronephros form and become functional in the 4th week of development. So this is false. Why? Because they don't become functional, but they form in the 4th week of development, right? Then the mesonephric duct persists to form genital ducts in both sexes. This is false because it only forms genital ducts in males. I remember we mentioned that at the end. Number C, the renal pelvis and the collecting tubules are derivatives of the metanephric blastema. We said nephron is the one that comes from the metanephric blastema. Your renal pelvis comes from your what? Your mesonephric duct. Okay, perfect. So your renal pelvis comes from the ureteric bud. Okay. Now, lastly, the ascending kidney progressively receives arterial supply from the abdominal aorta. This is true. I think we mentioned this part. Then a horseshoe kidney is usually located at the level of the bifurcation of the common iliac. False. We mentioned that this is at the level of your what? Your inferior mesenteric. Perfect. Right. Next one. About the development of the kidney and the ureter. Both pronephros and mesonephros develop in the same week. Okay, so this is true. In the 4th week, you said you initially form your pronephros, but still in the 4th week, as the pronephros are start to regress, you form your mesonephros. So they happen in the same week. Your mesonephric duct developed from intermediate mesoderm. This is this is definitely true. And we remember we spoke about this and said it all comes from the mesonephric, from the intermediate mesoderm. Then the ureteric bud is an outgrowth on the mesonephric duct in women. So regardless whether you're male or female, it all comes from the mesonephric duct. Then in polycystic kidney, the renal tubules fail to canalize. Okay, so before we answer this one, I think there is this thing that I tried to actually like to show you guys. Okay, you have got, so these are just like I just took like pages directly from Langman, right? So that we see exactly what Langman says. So Langman tells you that you've got multicystic kidney and then you've got polycystic kidney diseases, right? So if Langman tells you that in multicystic kidney diseases, right, you have the nephrons, they fail to form, the ureteric bud, it fails to form, and this can lead to renal agenesis. So this is multicystic kidney disease, number one. Number two, if you are in polycystic kidney disease, it can be recessive or it can be dominant. But the idea is you have got cysts, right? You have got cysts that form in the collecting ducts of the kidney. Okay. So in polycystic kidney, you have got mass cysts, which are just forming in the collecting ducts. And then if it's multicystic, you don't form your nephrons, you irritate, but they don't divide. Now, back to our question. In polycystic kidneys, the renal tubules, they fail to canalize. This is actually false. They do canalize, but you find you have got mass cysts inside those things. Then lastly, when present, a horseshoe-shaped kidney is usually located at the bifurcation of the aorta. We mentioned this and we said it's false. Then this one was from Dr. I think our lecture, right? Urine development started the 10th day in utero. False. This is not the 10th day. Actually, it's the week. Then kidney arise from metanephric ectoderm and ureteric bud. False. It arises from the metanephric mesoderm, metanephric mesoderm, not ectoderm, and the ureteric bud. Then the pronephros form through kidney. This is false. Bowman's capsule originates from the ureteric bud. False. The Bowman's capsule is actually part of the nephron, so this is false. Concerning development of the bladder and the urethra, intermediate mesoderm forms the detrusor muscle of the bladder. We said we answered. I think I actually answered this question already. False. This is not it. Remember, I said planching mesoderm surrounds the cloaca, and muscles around the cloaca are going to be coming from what? Your splanchnic mesoderm, right? So lastly, the cranial portion of your urogenital sinus forms your urinary bladder. Yes, we said this is true. Then the entire male urethra develops from the caudal portion of the urogenital sinus falls. In males, the pre-prostatic, the prostatic, and the membranous urethra comes from the pelvic portion, and then the caudal portion gives the spongy urethra. The urine dripping through the umbilicus in neonates may indicate a patterned vitelline duct. False, it's a patterned urachus. Then in extrophy of the urinary bladder, its mucosa is exposed. Definitely this is true, right? So with this, we are done with our MCQs.